welcome back. Dr. Ian Rassel from Corrective Spinal Care of California. Today is all about sharing with you how chiropractic care helps eliminate sciatica. So it's important to understand, what is sciatica? Sciatica comes from the bones in the lower back. Well, that's one of the ways, the bones in the lower back. But sciatica is when the nerves that come out of the bones in the lower back can get compressed and entrapped. Now there's three areas that you can have entrapment in those nerves. First is going to be in the joints, right? If you have misalignments and poor mechanics in your lower back, the joints can press on those nerves and give rise to this sciatica. Now some people describe sciatica as pain on one side of the lower back, can be pain into the buttock and down the leg, down into the calf, and also into the foot, into the big toe. So if you have multiple areas like that, that is sciatica. If you only have one of those areas, that's typically not going to be sciatica. That can be something else. Not only are we going to have pain in these areas, but we can have numbness and we can also have tingling. Okay, so the first place we get those is from the joints in the lower back. Those nerves can be pinched directly there. The second way can be from the discs. So these shock absorbers between the bones, they help protect, they help cushion. These discs over time can start to wear due to bad posture, bad mechanics, sitting, lifting improperly, or as you can see here, a major misalignment, a major subluxation. You can see these bones are not in their regular position. This is somebody's lower back. That's their left hip, that's the right hip, and ideally their spine is supposed to be straight. You can see it's going way off to the left and then way off to the right. Over time, with this sort of posture and mechanics of your lower back, the discs will start to deteriorate. They'll start to wear, and we get what's called a bulging or a herniated disc. The third way we can have sciatica can come from the muscles deep inside of our buttock called the sciatica. Called the piriformis. The sciatic nerve goes through the piriformis. So if you have piriformis syndrome, that can entrap and cause that sciatica pain that you're experiencing. Now, as chiropractors, we actually affect all three of these areas. So with the joints, right, if the alignment is off, we help with our chiropractic adjustments to slowly, over time, move those bones into a more stable position. Okay? If we have disc injury, if the discs are bulging or herniated, in our clinic we use a manual spinal decompression. So we're actually able to, if there's a disc bulge, we're able to gently pull those bones apart, alleviating some of the pressure that the disc is putting on the nerve. Manual spinal decompression is a very powerful tool. I highly encourage those that have been dealing with sciatica, reach out to us, reach out to a corrective care chiropractor and get to the bottom of what's going on. Figure it out. Is it the joint? Is it the disc? Is it the piriformis muscle? Or maybe it's two or three of them. Okay, so the manual decompression is very, very helpful for the discs. Now for the piriformis syndrome, there are very specific exercises, stretches, and strengthening exercises to help correct that problem. And the most crucial thing I want to communicate in this video is you got to get to the root cause. You've got to figure out, where is this nerve pressure coming from? If we look at a picture here, we're going to show you, this is the anatomy. Imagine this is someone's belly, this is their pelvis, and we took all the intestines out. This is what you're left with here. We can see these beautiful muscles, right? This muscle group here, this is your psoas muscle. Please Google psoas, P-S-O-A-S. It is a major hip flexor, and as you can see, it originates in the lower back. These are the bottom 5 bones in the lower back into the lumbar spine. They come together and they are the major mover to cause hip flexion, or the lifting of your leg. Now if we go a level deeper, we take the muscles out of the way, we can see we're left with the nerves. And I really want to put our attention in the nerves in through here, because you can see L4 and L5, those are the bottom 2 bones in the lower back. Those nerves are going to come together with some of these sacral nerves and go through this sciatica foramen, and you can see, look at the size. This is a large diameter nerve. In fact, it's, besides the spinal cord, it's the largest nerve in the body. So now we fast forward, we can look, we're going to go on the back side. So imagine we're looking at, there's your right buttock, Here's your right leg. So we see there's that greater sciatic foramen where that sciatic nerve comes out. Huge nerve that comes down the back of the leg. This nerve is innervating, or it's feeding and sending signals to your hamstring muscles, all the muscles in the back of the leg. We can see into your calf and eventually into your foot. So this is why people with sciatica could have pain in the lower back. They could have pain in the buttock, into the piriformis. They can also have the sensation eventually traveling down into the leg, past the knee, over into the shin, and into the big toe. If you or someone you know is dealing with sciatica, tell them to look to the root cause. Reach out to us if you have questions. Get to the bottom and figure out, where is your sciatica coming from? Is it the joints? Is it the disc? Are we dealing with the piriformis muscle? And then we've got to address it specifically. Just today, this patient started care, and mind you, she's getting massages 3 times a month for the last 2.5 months. She's been to 3 different chiropractors trying to get some relief. And our clinic is a hub for people who are suffering like this, because we're able to deal with the joints, the disc, and the muscles. We're not just dealing with the muscles, we're not just dealing with the pain, we're getting to the root of the problem. I hope this helps. Please reach out and share it with people you love.